The usual approach if somebody has pain, first off, they're often not taken seriously. They're told this is a part of being a woman, get used to it. But also, first line is often hormonal suppression, where they give either medications that induce a type of chemical pregnancy to the patient, or medications now like Lupron or Orilissa, which induce a type of chemical menopause, to try to suppress the endo and to keep it from growing and to feel better. Well, hormonal suppression has not been proven to prevent progression, even though that's a common recommendation for it. Patients might feel better, but it doesn't help fertility and does nothing to the actual disease. So because they're given hormones, there is this delay in diagnosis. And we and others have shown that if you actually remove the disease well, again, in all of its form, that the rate of it coming back or progressing can be very low. In our study, it was 0 for stage 1 to 3. That implies if you cut it out well, it can't grow. So we'd rather actually get it early, which is really the message of others like Padma Lakshmi, who had bad endo. She's an Indian supermodel and the host of Top Chef. She was not diagnosed until later in life, like age 35 or so. You can find her story online. But she had years of painful periods, debilitating. By the time it was diagnosed, it was very advanced. She could not get pregnant. She would say of herself that if she could have been diagnosed like a decade earlier, she could have had it treated earlier, avoided pain, and maybe preserved her fertility. So she has produced a poster called Killer Cramps Are Not Normal to get the word out that if a woman has pain with periods or significant pain that she knows is not normal, she's curled up in the fetal position, lying on the floor during her periods, planning vacations around the period, missing school or work, getting or using narcotics, and now it's CBD to get through the period. That's not normal. And then taking hormonal suppression but not feeling better. These are all red flags and they should get checked out and checked out early. We very much are on the same page as the organization that she and her doctor, Dr. Sexton, founded, which is called EndoFound, or Endometriosis Foundation of America, to say we'd rather cut out the disease early and treat it early before it progresses, because women deserve better with endometriosis.